Welcome everyone to this community forum for the Swan Hill Rural City Council, which actually runs for an hour. We welcome everyone on live stream Facebook as well as through YouTube and Zoom. My name is Peter Abraham. I'm the CEO of Swan Hill District Health. I'm your host for tonight, and we have a panel of speakers tonight as well, including Dr. Bruce Boland, who is the Director of the Loddon Public Health Unit, Loddon Mallee Public Health Unit, Jackie Turfrey, who is the CEO of Mallee District Aboriginal Service, Jane Main, Area Director, Executive Director of Mallee and North West Victoria Region Department of Education and Training, Mara Richards, who is the CEO of Ron Vale District Health Service, and Sue Tomlinson, Operation Manager at Bendigo Health, Loddon Public Health Unit. So welcome all. And I think we have some questions a bit later on for the panel that have been already submitted through. There is another opportunity to ask questions a bit later on or to submit questions, but we'll provide you that information at the end of the chat. I'd like to now move to our Welcome to Country. We have a recorded Welcome to Country from Vicky Clark, who is a local elder. Thank you.
When I acknowledge country, I acknowledge the ancestors that walked on this land for at least 60,000 years. The land that I have here in my hands, my ancestors from Lake Mungo walked, played, practiced ancient ceremonies 60,000 years ago. This is my mother's Coolamon. And these are the sacred lands that I acknowledge right across Aboriginal Australia.
We thank Vicky for that presentation and that welcome to country and acknowledgement of country. If we move on now, and just a quick overview from me, I guess, and maybe Mara could also add to this as the CEO of Ron Vale District Health Service. Clear to say that over the last 3 weeks, or so, since we started to get some wastewater detections pinging in the local community, that we've had a fairly bumpy and turbulent ride with the start of a few asthmatic cases of COVID, and then increasing cases, a varying number of cases over the days. It's changed a lot, the outbreak for us and our management internally for health services. It's been an enormous piece of work, I know, for Mara and myself as well, and for Jackie, and also for Paul at MDAC as well, to ensure that we're providing the right level of services and changing our service mix and getting the balance right between managing COVID and managing the everyday community need for health services. I'm not sure you wanted to comment there, Mara. Once mute comes off.
Yes, thank you for that. So I'm not very technological. Yes, thank you for that, Peter. I agree that it's been a very interesting few weeks in our local government area, and I'd like to give this quick update for Robin Vale at your request. We currently have no active cases, which is really pleasing to report, and I guess the turbulent ride has slowed for us. We're not anticipating any changes to this. We had two women, one in their 50s and 60s, that both left quarantine. We had two children which Jackie would not like to know, but they went back to live with their grandparents in Mildura. We have one 6-year-old child who is from Boundary Bend, and they're coming out of quarantine in the next few days. And they've RDHS has been monitoring them under the hospital and the home program, and they were a school student from a Swan Hill school. I'd like to just make a special mention, if I may, Peter, about the immunisation program, which has been very successful in our seasonal workers in Robinvale, which was always a fearful tinderbox potential in our local government area. And I'm pleased to report that 2,500 seasonal workers have had their first dose, and 1,500 are fully vaccinated. So that is a really pleasing report to say, and they are very keen. They're keen through the GP, through Bendigo Health, through MVAC, and through our local Amcal pharmacy. They've been coming up and stepping up to the plate to be actively seeking vaccination. Our testing has been declining over the past few days. It began early in October at 50 plus a day, culminating at about 128 tests a day. And now we're doing about 10 to 20. Our main focus now is messaging to the community as required every 1 to 2 days about the safety precautions to take with COVID. So thank you very much for the opportunity, Peter.
Thanks, Mara, for that. A quick update on Swan Hill District Health. And I know I'll be throwing to Bruce Boland, Dr. Bruce Boland in a minute, who is the Director of the Public Health Unit. So I don't want to steal his thunder, but Swan Hill District Health is currently managing around about 61 at the moment. It changes every day and it changes all the time, depending on who's coming off on their 14-day completion and who's coming on in terms of numbers coming on. Around about 61 people in their homes who are COVID positive. The homes are predominantly in the township of Swan Hill, and I think around about 30 houses or so. There's also, as we know, some cases that have seeded or have also presented in Lake Boga, Nile West, Tintinda, and Wooranen. So a few plus some cases that we're watching down the Kundruk Barron Way as well, which is part of our sub-regional responsibility as a health service. There's no active cases in the Swan Hill Hospital. We have had a couple through our emergency department who have since tested positive, and they've been managed pretty well, I would have thought, and then transferred into COVID streaming, what we call COVID streaming hospitals for higher care. Every person in the Swan Hill cohort of our cases at the moment are either very low or medium risk, and therefore don't require any higher level care than daily visits that we do or daily contacts that we make. And they're all monitoring themselves at home and in the most compliant as well. So I might pass on now to Dr. Bruce Boland to talk about the trend in the cases.
Thank you very much, Peter. And I'd like to start by acknowledging the traditional owners of the land as well that we're meeting on today, and Aboriginal elders of the past, present and emerging, and particularly the incredible Aboriginal community engagement and leadership we've had right the way through the river, through a really significant growth in cases that Jackie and many others have been heavily engaged with. And I'd like to thank everybody on the call for your support and engagement. I know there's been a huge amount of support in response to everything that's happened, and particularly for the Aboriginal community. That has been a major focus of work to date in our area. I'd also like to acknowledge the other leaders that are on the call here today from the different services. I've got to say, from a public health unit perspective, we're based at Bendigo Health, myself and Sue and the rest of the team. And we kind of like to see it as leading through partnership, very much working in partnership with the agencies in the local areas where you know the local circumstances. And I've got to say, I feel that the community is in exceptionally safe hands with people such as Peter and Mara and Jackie and Paul and many others who we've been engaging with in the response to date. So in terms of the current situation, as Peter says, since we started seeing wastewater detections at the beginning of this month, broadly in the first couple of weeks of this month, and then since that time, since about the 11th, so about 2.5 weeks ago, we've seen a incidence of cases. In total, 76 cases since the 11th of this month. 5 of those were new yesterday. And as Peter says, we currently have around 60, 61 active cases. That changes all of the time, of course, as people come on to and leave the system. Importantly, we've seen, because the population size in the area is comparatively small, that does mean there's an inherent bit of volatility in the numbers. And we've seen at the beginning of that period, fairly low numbers. We then saw a distinct spike around the 21st, 22nd of this month in new cases and exposures. And then since that time, it's kind of declined and it's kind of moving around a little bit. And so really what we're expecting with the outbreak at this point is potentially it could continue for some time. We hope obviously with fairly low numbers of new cases. In particular, at the moment, we've seen 47 households. So what we often see in many outbreaks is that when a case occurs, often it's the people who live with that case that are at the highest risk, of course, of infection. When those infections remain within a household and everybody's been isolating and quarantining, it's of course significantly of less public health concern than when we see new households popping up. So we have seen an increase in new households in recent days, happily in low digits. So 4 from the 26th of this month, so over the last couple of days, 4 new households. But we're not talking large numbers. So we're not anticipating a sudden growth in cases at this point, although of course we can continue to really closely monitor the situation in Swan Hill. As Peter's alluded to, the vast majority of those cases are within the Swan Hill area, and of course a smattering elsewhere, including, as Mara noted, in Robin Vale. We had a few cases previously. The best news out of this is that while we know we are moving away from a strategy of elimination, i.e. getting rid of COVID full stop, we're now formally recognising through the state policies that over time, it will be what we call an endemic condition. It will be a condition which regularly occurs in the Australian community and the Victorian community. So we're expecting to see new cases. The point is here, in the new cases that we've seen to date, the vast majority of them are in the under 50s. We've seen very few cases in the over, in fact, only 4 cases in the over 60s, which is by far the group that we see as having the highest risk of severe illness, resulting potentially in hospitalization and severe outcomes. The reason that we're seeing that cohort of under 50s being the ones at highest risk in this particular outbreak is basically a reflection of the fact that those groups obviously have had less access to vaccination, the over 60s having been, of course, the first priority cab off the rank, as it were, for vaccination. So the fact that we're seeing the majority of these cases in the under 50s, many of them in the under 40s, and indeed in school-aged children, while of course any case we take very seriously indeed and actively monitor, as Mara was referring to earlier, in a number of different programs, including our Hospital in the Home program, which is excellently run here and also supported by Bendigo Health. The vast majority of those cases we would anticipate to be in the mild to moderate end of the spectrum, whereas obviously when people have got pre-existing conditions, or if they're in the over 60s, over 70s, over 80s, that's where by far we see the highest degree of risk. So I have to say, to date, even though we're seeing an increase in cases, and of course any case is a concern to us and we're on it from a public health perspective and a clinical perspective, of seeing the profile of cases that we're getting at the minute is a comparatively low risk. And it demonstrates, I think, the strength of the strategies which have been put in place to date in the Victorian response and the effort of everybody locally to turn out, get tested when needed, and get vaccinated, most importantly, to prevent any further transmission and prevent severe disease. So we have obviously seen a lot of exposure sites associated with this outbreak. As everybody should be aware by now, we're no longer publishing every exposure site by tier 1, tier 2 on the Department of Health website. We are still publishing, it's important to say we are still publishing where we think there is a significant public health hazard which may not be controlled. And that's basically if we think that it's a site where close contacts may have been exposed and where we're not convinced that we know exactly that everybody was there. So those people can still be confident that those will be published when required. But the good news here is that while we've obviously identified a large number of exposure sites, those exposure sites have been doing the right thing. They've been identifying people, they've been getting in touch with people, bringing people forward for testing and vaccination as appropriate. We have obviously seen a couple of significant exposure sites associated with educational settings. In primary schools primarily, and of course that does generate a lot of community concern, quite rightly, and a large number of tests being taken. That's been a really big rallying response from the team here at Swan Hill Health and from many others in the region, and again obviously the public health unit which I lead also providing a bit of support for community in relation to that. So we have seen a huge amount of testing occur within Swan Hill in association with this latest outbreak, and from the public health unit I say thank you to everybody who comes forward to get tested, particularly if you're symptomatic and if you've been contacted by a health authority in order to seek testing to make sure you and the community stay safe. I'll dwell then on the kind of the better news bit again of this as well, which is that, as everyone would be aware, Swan Hill as a local government area has an excellent level of vaccination update to take. In the over 15s, over 16s, we see well over 95% by the census projections as having had at least one dose. Approaching 76% as having 2 doses. Obviously, if we look at younger cohorts down to the 12-year-olds, it becomes a little bit lower, so about 84% first dose and 59% for 2 doses. But nevertheless, this is an excellent level of vaccination. And I personally thank everybody who's got out there and been vaccinated. You're doing a tremendous job, not just of making sure you don't get severe disease, but also stopping the spread to more vulnerable community members as well. And obviously, the more we can do to raise that vaccination rate and keep that going as well as we possibly can, the safer our community will become over time. And we can be very confident that when we do see new cases, they will have lower likelihood of spreading in the community, and the severity of those infections will be very much moderated. There is a big bit of work happening and needing to be done, particularly focusing on vaccination in the remaining under 40s and particularly school-aged children and young people to get those vaccination levels up as high as possible. Obviously, those vaccines have only been available for people relatively recently, so there is still a lot of ongoing work, which Swan Hill and many other services are doing a fantastic job getting those vaccination rates up as we possibly can. I'll kind of conclude then by just kind of reiterating, obviously, it's a significant public health concern whenever we see a case of COVID, but we know that we're moving into a circumstance where we are going to be getting cases of COVID throughout all Victorian communities, and Swan Hill is no different. Dealing with this outbreak here, you can be confident that you've got an excellent team on the ground that are working closely with us at the public health unit. And most importantly, because of the high vaccination levels locally, we can be confident that the vast majority of people are safe currently. We will respond to every case and every outbreak as quickly as we possibly can. We know it can be frustrating for people when they hear things on the ground and they're not seeing everything being published, but rest assured, if you're symptomatic, please do seek testing. It is available. If you've been approached by a health authority to seek testing, whether or not you have symptoms, please do seek testing. And if you're eligible for vaccination and you haven't yet had that chance for a jab, please do reach out to your trusted GP or your other health professional. They can give you the information and advice you need. If you know folk that are hesitant, that's absolutely understandable too. Please do encourage them to speak to their health professionals to get the advice for their decision around their vaccination. And obviously, the higher the vaccination rate we can get, the quicker we can get on top of this outbreak. So I thank everybody in the community, and particularly the services involved in the response today to this significant outbreak in Swan Hill. And we look forward to those numbers gradually declining over time.
Thank you, Bruce, for a wonderful synopsis, as usual. I would now like to pass straight on to Jackie Turfrey. Jackie is, as I said before, is our wonderful CEO for Mallee District Aboriginal Service, and will give us an update on the community locally. Thanks, Jackie.
Thanks for that, Peter, and thanks for the update, Bruce, on the case numbers and how this particular outbreak is tracking. So one of the observations that I want to make, and it segues very nicely off the back of what Bruce was just talking about, and that is essentially the way that we're seeing transmissions occur and around households. The significance of this for our community is that we tend to have a much higher risk of transmission within households, typically in our community, because we actually have much larger households. So we have a lot of overcrowding in our limited housing supply. We have much higher levels of homelessness as well, which means that when you're in a pandemic outbreak, people who are in our community, our mob, who are typically homeless, will go and jump in with one of the family members. If they've actually already been exposed to the COVID virus, then that actually means that that household, which typically can have quite a large number of people, they will all be affected by that. So that particular trend is of real significance in our community. What I'll say about that, though, is that within our community, what we're seeing in Swan Hill, but as well as Mildura, because we actually manage a much bigger population up here, is that most of the transmission within the Aboriginal community by Aboriginal community members is with the Aboriginal community. Typically, our members are not out at Bunnings, for example, shopping, so they're not that particular group of people, and so the transmission within our community is pretty confined to our community. However, our community, as you'll note from what Mara was saying, they do move along the river, and what we're finding is that even from the Swan Hill outbreak and the Robinvale outbreak, we've actually had a lot of the community members who are affected coming back into Mildura, and we manage them once they hit here. What I'll like to give everybody a bit of a line of sight on is that MDAS has been running vaccination clinics for a little period of time. What we've done is we've opened up those vaccination clinics to the general public. We haven't just made them available only to Aboriginal people. And there's a very good reason behind this. Our community tend to have what we describe as a vaccine hesitancy issues, which is quite an historical situation based on fears and myths and rumours that come out of all kinds of history to do with colonialisation that's then embedded into popular culture, and makes it quite challenging for many of our community members to trust a very rapid rollout by government of a vaccine that they believe is not very well tested, despite the evidence that demonstrates that it's a very well tested vaccine that's actually been around for a very long period of time because of the nature of the SARS virus. And the testing actually has been done over very long periods of time. Just doesn't help our mob because they just are quite suspicious of it. What that means for us in terms of our vaccination rates is that we are typically much lower, have much lower vaccination rates. And I'll give you a bit of a line of sight on what that looks like. So for our vaccine clinic that we've run in Swan Hill, we've managed to vaccinate over 3,000 people in our clinic. Out of that 3,000, less than a third are Aboriginal and Torres Strait Islander people. So it gives you an idea of what the difference in the vaccine uptake looks like. Why we're actually making the vaccines available to everybody else is because we recognise the historical basis and the reasons behind vaccine hesitancy. We acknowledge that. And so we've taken the approach of the herd immunity is the best protection that we can actually deliver to our mob in community, because if we can get other people vaccinated, it actually significantly lowers the risk to our own community members. Again, because we are the lowest vaccinated group, not only in the region, but across the country, that actually means that we're the highest group at risk of transmission. And that doesn't mean necessarily between us, but in getting the virus. And then it means that we're going to have a much longer period within our community that we have to deal with the health implications of the virus as it rolls out over a longer period of time, and it will continue to affect us for longer. That means that our service delivery needs to be shaped up to be able to manage that longer term response to COVID outbreaks. What we've done in Mildura, which we will be doing in Swan Hill if the need pops up in the same way as it has here, is we've actually modified our method of delivery of vaccines into our community. We've actually started delivering vaccines in home along with swabbing. What we're trying to encourage our community to do is get tested. If they're unwell, to isolate. If they're not showing any symptoms and they're not positive, then to vaccinate. We are just going to have to keep over a long period of time addressing our community's need for vaccines in quite unique and bespoke ways, and we will continue to do that and deliver that. We've been supporting our community members as well as we can through food support. So if our community members have to isolate, then we make sure that they get appropriate and good nutrition for the period. So we're trying to discourage our community from going out of the place they've been asked to isolate. And we're doing everything that we can within the service, within reason, to support community members to be able to stay at home. One of the trends that we have noticed here in Mildura is that our community have been very afraid of the virus. They recognise that they have much lower vaccination rates. So out of your total population, they tended to stay at home more than anyone else during the peak of the outbreak because they were scared of catching it. Swan Hill hasn't been very dissimilar to that. What that means is it puts a lot more pressure on us as a service to make sure that we actually manage some of that for you, but support people to be able to do that. I cannot promote strongly enough just vaccination and testing, particularly not just Aboriginal community members, but all of the community in Swan Hill, because when we can get a good track on where we have outbreaks and cases, and particularly where it's affecting households, that enables our service to better deliver service into the community and understand what it is that we need to be doing and how we need to respond. Thank you all for your time this evening. And it's a very beneficial type of forum to find out what is actually happening in your area. Thank you.
Thank you very much, Jackie. Can we move now to Jane Main, who's just popped up on screen, who is representing Department Education Training. Thanks, Jane.
Thanks, Peter. And good afternoon, everyone, or evening, really. I just want to preface this by saying, whilst what I'm going to share with you is the Department of Education's response, and it is shared with the Catholic Education Department and the independent schools, and they have committed to following it. It sometimes rolls out slightly differently to the government schools. So that my area of knowledge and insight is into government schools. So our response has been developed in collaboration with the Department of Health, and it has changed significantly as the pandemic has changed also. So the latest advice is that some things haven't changed. If a school gets a positive case on site, be it a child, a young person, a teacher, or somebody visiting the school, they notify our Incident Management Centre. From there, they will be contacted and advised of how to manage. One of the changes is that they get a spreadsheet that's prepared by the Department of Health that comes from our department, and the principal will identify primary close contacts. And they've got a fairly tight identification key to for notifying those people. They provide those primary close contacts with some prepared information and also a phone call. And then they respond by giving the department the spreadsheet, and that spreadsheet in turn goes to the Department of Health. The schools then check on their cleaning status and will do an extra clean, what's called a high service touch clean. Then that gives the go ahead to see whether the school needs a 24-hour close to further the investigation into the primary close contacts, or whether they can remain open. Largely, our government schools are remaining open, so that requires a fair bit of work on behalf of our school principals and their leadership team, but it's trying to enable least impact on the broader community and obviously other parents who are working in essential services being furloughed. So if our students are, or our staff are primary close contact, they are contacted by the Department of Health, but initially by us, with the advice that they are required to isolate for 14 days unless they are fully vaccinated. So as Bruce gave the figures before, many of our students in secondary settings, or even some of our grade 6s, are fully vaccinated or moving to that end, and that means they only have to isolate for 7 days. They do have to test before coming back to school and receive a negative result and be well when they return to school. On occasions, some families are reluctant to have their children tested. If they aren't tested during the 14 days, they need to do a second lot of 14 days and remain at home. That's just a protection for the school cohort. One of the other questions that was raised was around VCE. As many of you would be aware, the VCE exams commenced yesterday with the English exam, and there has been provisions explicitly for our VCE students who are primary close contacts but not positive. It's really important to emphasise our positive students will remain at home, but those students who are primary close contacts can sit their exams on the school site but in a separate room to the general cohort of that year level, sitting that subject. The supervisor has additional PPE, and the student has the same criteria for the exam. However, they may well be in a room by themselves or could be with just a couple of students who are in the same situation. And we're not talking huge numbers across Swan Hill. We don't have any of our secondary providers with 1,000-2,000 students like may occur in Metro. After each exam, the room is thoroughly cleaned, and if there is a need, a second exam is uses the same facility. Students don't have to take this option. If they are primary close contact and they don't want to leave home to sit the exam, they will be given a derived score. So that's a conversation for that family and their school. There was one question I think I've covered off. There is a difference between the requirement for vaccinated and unvaccinated students and staff. As I said, it's either 14 days or 7 days if they're fully vaccinated, and obviously that all of our children under the age of 12 are currently unvaccinated. So I'll cross back to you, Peter. Thank you.
Thanks, Jane. Done a wonderful job. You've even answered some of the questions that we had posted earlier. So I appreciate that. But just hang around. We might. That's the end of our speeches, if you like. And now what we move into is a bit of a panel discussion. And there were some questions submitted earlier. There will be another opportunity to submit questions that we'll talk about at the end of this. But I might just get, if I can, Bruce, Sue Tomlinson as well on the screen to join us. Now, I haven't introduced Sue. Sue Tomlinson is really the workhorse, I guess, behind the public health unit. Bruce is just a figurehead, really. I shouldn't say that, Bruce. Sue is the operations manager for Loddon Public Health Unit. Sue is the person who notifies us straight away that there's a positive case in the local community. Works many hours. And Sue, I'm going to bat off with the first question myself. It didn't come up in our question list, but I think it's important to ask you, why is it taking so long to get a test result? So we're getting reports of 4 and 5 days. Have you got any intel? And Bruce, I'm happy for you to chime into this one as well.
I'd like to say that I have a lot of intel. The reality is it's just a volume thing. So at the moment across the state, there's a lot of activity. There are a lot of tests going on. All of the pathology centres have got extra staff. They're working extra hours to try and accommodate the tests. It's just still not quite enough. So certainly where there are uneven loads. They are trying to even that out. So there's definitely work happening within the pathology and across the different pathology centres to redirect swabs or samples to different pathology who might have lighter load to try and improve that service. It doesn't always happen. There is a priority order for tests as well. So the priority 1 tests get sort of priority, obviously, that's the name of it. Some of that is the essential workers, some of that is the symptomology and different types of things that make them a priority. So unfortunately, despite everybody's best efforts, there is a delay at the moment, and they are certainly working on trying to reduce that back to something that is improved.
Yeah. The only thing I'd add to that, absolutely completely agree with Sue's comments, and yeah, we're as frustrated as everybody else out there. I mean, obviously we're not the people having undertaken a test, which is really stressful if you don't know your disease status. But from a public health perspective, of course, we want to see those results as quickly as we possibly can to get on the front foot. So rest assured, there's a huge amount of effort going into it. The only thing that I'd add is that people may have heard of different sorts of rapid tests. There's a lot of work going into looking at what rapid tests will be applicable for Australia and for Victoria. Obviously, they're soon going to be available in shops. They're already available for residential aged care, in particular for surveillance of staff in the context of outbreaks, obviously for our most vulnerable. The science behind this is basically we're still getting the advice from the mega brains who make the national decisions on these things. The bottom line is, while they are quick, they are not as accurate. That might seem obvious, but there's a lot of fine-grained decisions that need to be made in terms of how we use those in the pandemic response today. No doubt, rapid testing will become a more prevalent thing over time as as we move away from elimination and towards suppression. But currently, it is still an evolving landscape. And what I would emphasize is that the tests that people are getting at the minute, in the vast main, are the gold standard. They are the most authoritative way to get a clear idea of whether or not you've caught the virus, basically. The RAT tests, as they're sometimes called, the rapid antigen tests, are great, really much quicker turnaround times, but not as accurate. So there's a lot of thinking going into what that might look like. That's not nailed yet, and it will continue to evolve.
Thanks, Bruce. So I just want to make the point that any tests that are done here in Swan Hill, and I'm sure in Robinvale as well, and we're doing over 200 a day here still at the moment. We peaked at 400. But at the moment, around about 200, 250 a day. All of those tests are sent to Melbourne. So it's a 4-hour ride to Melbourne. At least it actually via a few places where they pick up more tests along the way and go into that priority listing of tests that somehow go into a big bin somewhere, we think, in Melbourne. So, there might be a bit of a perception that tests are done here. The only tests that we do at our health service are the rapid antigen tests. We do that for every person coming into our emergency department, and we do that also pre-anaesthetic or pre-theatre for operations. So just to clarify that one, if I can just add. Okay, we'll move through the questions now. And Jane, I'm pretty sure you've answered most of your questions that relate to isolation period, vaccinated, unvaccinated. There was one here that talks about a parent reported that they were advised at a testing clinic. It might not be you, for you, Jane, at a testing clinic, 7 days and 2 tests. So, Sue, is it 2 tests that you have in 7 days?
So mostly what we ask for primary close contacts is that they get tested initially and then they get a test on their exit from quarantine. If that's 7 days, then that's day 6. If that's 14 days, then that's day 13. So I suspect, but I couldn't tell you on this individual case, that the 2 tests are related to the initial test and then an end of quarantine test.
And Peter, can I add to that? So particularly for students returning and staff returning to school, the principal will request evidence that they do have a negative. Just again to be, their role is to protect all on site. So we go the conservative. Some families don't want to share that, and that's okay, but that request will be asked of them.
Okay, thank you. I think the other big concern for the community, Bruce, and you've already raised this in your earlier talk, was about that tier 1 exposure site. And I think the question here that I'm reading, can someone explain why tier 1 exposure sites are only shared in the days after the original exposure? Also some we never hear about, it's hard to stay safe. You know, there's a lot of concern in the community about staying safe if they don't know where to stay safe from.
Really?
Yeah.
It seems it's a very reasonable thing, and it has been a big part of the effort to date, of course, to really, while we've been particularly in an elimination strategy, a huge amount of the effort goes into really trying to get a hold of every case, the details of every case, and try and stop the spread. Obviously, it's still a priority, but we're recognizing now as we move into a suppression approach that we are going to have cases and outbreaks occurring. Our focus in that context is on the highest risk. So where the people, the places at highest risk of exposure and of severe outcomes are. So people can rest assured we're absolutely on that like ninjas as soon as those cases and exposure sites are coming to site. What we're starting as a system to do less of, and this is thought about very, very hard from Department of Health onwards, what we're starting to let go of is exposure sites, for example, where there could be potential for large volumes of people at very low levels of risk. So to illustrate that, we had some exposures at the Bendigo Marketplace, which is the main shopping centre in Bendigo a while ago. That brought forward 3,000 people for testing in 2 days. From those 2 days worth of testing, which was great, everybody stepping forward, we identified precisely 0 cases. Now, that isn't to say that there's no risk associated with these places, but we know that we need to focus our effort towards where the highest risk is and where the maximum yield for tests to find cases is. And so broadly, our public health strategy is focusing like that. It's totally understandable that people feel, we're not getting the same information as we had previously. Rest assured, where if you've been exposed and you're a primary close contact and you're of significant public health concern, one of the public health team from the Department of Health, it could be through reaching out from your school or from your workplace, but particularly from the Department of Health and particularly from our public health team, will be in touch with you to let you know if you've been exposed and what actions you need to take. You could be informed in some instances by text, but more often than not, it will be a phone conversation or a conversation with somebody to say, yep, there's been an exposure, you need to take some action. What we have seen a lot of people, understandably, particularly when schools happen, there's a lot of anxiety that provokes. Want to be really clear, going to Jane's points as well. It's those people who are at risk, they will be told they're at risk and they'll be asked to say, go and get tested. When it's most important to get tested is when you're symptomatic. And if you've been reached out to by an authority to say, please go to get tested, absolutely seek testing. But for the vast majority of instances, it is unfortunately going to be a reality of our lived lives in Victoria for some time to come, that we are going to be moving through shopping centres where controls are occurring. And a case may pass through, but we know that shopping centres are actually extraordinarily on the case. When they know that there's a case, they get out there, they clean up. There's very, very few instances now where cases do occur, for example, for a shopping market exposure. So it raises a lot of anxiety, but it's actually comparatively low risk. So that's just giving a bit of colour and movement. Bottom line, if you're symptomatic, get tested. If somebody gets in contact with you to get tested. Otherwise, just monitor the DH exposure site website. That's your source of truth for the genuine issues of public health concern, as opposed to well-wishing rumours in the general community, which are understandable, but aren't necessarily what we in public health would say are the top priorities.
Thanks, Bruce. A further question that came up, probably for Mara and myself, about when there are cases of COVID, and I'm happy for Bruce and Sue again, and anyone else. Could it be said whether there have been a case has been hospitalised, is in hospital, or is at home? I think there's always a concern there's always a challenge actually producing case numbers every day to say here are the numbers and here's the amount who are in hospital, here's the amount who are safe at home, because it changes a lot. I think we sort of raised that earlier, but But is there anything around those concerns, to allay those concerns around whether cases are at home, where they are in the community, which homes are infectious, if you like, according to people, or and who's unwell and who's in hospital?
Yeah, absolutely. So Sue might want to chip in on this one as well. But broadly speaking, what we know of COVID is, for the vast majority of people, particularly if they've been vaccinated, COVID will be a mild to moderate respiratory infection, which is unpleasant, leads to a variety of symptoms, but will only very rarely result in severe illness. So in the vast majority, people who are infected can stay at home, isolate quite safely if they don't have pre-existing chronic diseases, if they're not in those very older age groups, which are at highest risks, if they don't have other risk factors like that, they in the vast majority will be entirely safe. Every single case is clinically appraised and looked at and determined, is that person safe at home, or do they need to be entered into what we call the hospital in the home program, where they are actively monitored by Swan Hill or by Robin Vale District Health providers. They'll be given a phone call, they'll be given equipment to monitor their condition very, very closely. Obviously, if that condition starts to change, that's where we start to step up the care. Bendigo Health is the local regional, what's called a streaming hospital, i.e. the place where for people who are significantly unwell, who can't be managed at home or at a local facility, they'll be brought in. At the moment in Bendigo, we're seeing, and it does change literally hour by hour and day by day, but we're routinely seeing well over 100 people within the hospital in the home program, a much, much lower level that are being admitted into hospital, and only single digits when it comes to ICU usage, so intensive care or use of ventilators. Now, obviously, every one of those cases and every one of those admissions, and ICU admissions particularly, is monitored exceptionally closely. The good news here is we've got a robust system in place, which goes from monitoring people in the home, taking them in the hospital when necessary, and accelerating that care. And because we've got such a high level of vaccination, we're only mostly seeing cases in younger cohorts. We can be pretty confident that the vast majority of those cases can be effectively managed in the home environment.
Thanks, Bruce. And I think a final question, and I think I might throw to Jackie on this one, just around we know that it's not just about managing the clinical care of these people, anyone in their homes who's COVID positive. There's so many other wraparound services that come in to support accommodation, food supports. I just wonder if you could just sort of touch on what else is available. I know we haven't got a Department of Family Fairness and Housing rep here today, but just on what might be available, to support someone to live their life in isolation. Thanks.
Sure. I can only answer from the perspective of my community, of course, because I've got a line of sight on that. And I know that there are a number of supports that are provided through a number of different agencies for families outside of our community. So what's happened in the region is we've found that an appropriate accommodation response was lacking. We first noticed this in Mildura, but it very quickly unfolded in Swan Hill, that we have a desperate need to be able to place people who are classed as being COVID positive. Now, Swan Hill is one of the locations that's actually one of the more difficult locations to find accommodation. So it was a bit of a challenge for everybody to be able to come up with some solutions. So between the local agencies, we've been able to be nimble enough, and thanks to Peter at the hospital providing a house, and the Department of Families, Fairness and Housing locally have been trying to work with us to get a mobile home option that can be placed in people's yard. So we're looking at the accommodation options. In Mildura, Midas was able to find a couple of its properties that it could quickly turn around and make available for Aboriginal community members who were diagnosed as positive, and we've put that up for temporary accommodation. So we move people through on their 14-day cycle. We're still working on what that response will look like in Swan Hill. We've had a number of people have needed some assistance. We haven't been able to deliver that really responsive look for our community members that we have in Mildura because of the lack of accommodation. But what we've done with that family is we've tried to make their stay at home as comfortable as possible. We've been able to support them pretty well with their food support and any other needs that they might have. As I stated before, we've got a lot of community members that need medication support. that need health support, and other just typical supports. They might be existing mental health clients, they might be existing clients in other parts of our business. We are continuing to deliver all of our services to our community where there's a critical need, and we even do that face-to-face if we need to with our COVID positive community members. We're taking on the challenge of being able to do that. We're being able to prove and demonstrate that we can do that safely because we're not getting transmission of that contact in with our staff at all. So essentially it's a case-by-case model for us. What do our clients and community need? What can we provide? And if we can't provide it, then we reach out to our partner agencies, such as the hospital or any other local support service that's available, and we ask for help. And what we're finding is that when we pull together as a team across the different service delivery providers, we're actually able to provide pretty good responses to those families in need who are at home and to actually deliver the supports they need.
Thanks, Jackie. Bruce, did you want to?
Yeah, Peter, I was just going to suggest Sue might want to contribute in terms of anything additional there from what it looks like, at least from a public health unit perspective.
Thanks, Bruce. Look, primarily, Jackie's covered it, and obviously from the perspective of her own community, but as a general rule, regardless of which community you're from, in part of the contact tracing and part of the interview is to try and elicit what sort of response or social support you have to be able to allow you to quarantine safely. So some of it's about how easy or difficult it is to isolate away from other people in your household. Sometimes it's around whether you've got enough supplies, so like food, masks, hand cleaning product, that sort of thing. But also whether you've got the right medications that you might need, or your scripts full, things like that. So those are the sorts of things that during the contact tracing interview, a contact tracer may well ask. And if you don't have a family or a friend who can drop off food or can organise supply, or you aren't sort of connected into, I'll say Woolies, but I'll have to say Coles as well in case I'm doing a preference there, but in their home delivery or any of the other delivery services that deliver. So most of them will do contactless delivery now. You don't have to tell them you're positive. You just need to make sure when they knock on the door that you don't open it while they're there, that you're making sure that you're wearing a mask, and you wait for them to step away. So having paid for it already online. So there are different ways of accessing food and supports, but certainly that's conversation that occurs during the contact tracing. Often if you're referred to medical care, which is part of the process, even the low level care, it might be that conversation is had there, just because the contact tracing hasn't happened yet. There might be, sort of depends on who gets in first, but certainly we have access to council numbers and all the appropriate supports that should be able to direct you to somewhere to make sure that you can isolate safely or quarantine safely, depending on whether you're a case or a contact.
Thanks, Sue, for that. And I'll throw to Mara in a minute, but I just want to shout out to Swan Hill Rural City Council for the work they're doing in the food relief and support as well. So there's a whole multitude of services happening, but I know Bruce Myers is online, so shout out to his team for the work they're doing. Mara?
Yeah, thanks, Peter. Just to reiterate and reassure the community that we've been putting plans in place as a health region for over 20 months. And I think at this time, what we're learning from Jackie and all the other players in this room is the impractical elements of that plan and how we together can work out the problems. And I think it's really important that, Bruce and Sue have become new best friends, and I know Jackie a little bit better now. So I think that, and Jane I've already known, but as health services, we've had these plans in place to escalate care, I guess, to ICU. But now the practical part of keeping people at home and safe and getting them from the low to moderate sort of illnesses at home is just such an advance. And we're here learning from each other and actually enabling us to manage us really good into the future. because that's what it's all about, learning as working together.
Thanks, Mara. On that wonderful note, we're going to wrap this up. I want to thank all of the panel for their commitment and their support and for providing such good information to the community. I hope everyone's got something out of this. If you want to, I'm just going to pass to Felicity now to provide some information on how to keep asking questions. Go, Felicity.
Great, thanks very much, Peter. Thank you to all the community members that have tuned in tonight. If you do have any questions, we have set up on our Council Let's Talk page an option for you to submit some questions. After you've submitted the questions, they'll be referred to the relevant authorities to be answered. I will post the link in Council's on Council's Facebook page, which will allow you to ask any questions that you may have. As Peter said, that concludes tonight's information session. So yeah, we'll finish our live stream now. Thank you very much.